All right. Hi, my name is Derek Prusener, and I'll be representing our team, carSEAL. For endovascular procedures, no device exists for effective closure of the carotid artery. Stroke is one of the leading causes of death in the US, with 700,000 ischemic strokes annually. Longer strokes increase the risk of long-term disability as 1.9 million neurons are lost per minute. The gold standard for endovascular thrombectomy is through the femoral artery, which generally takes 57 minutes. While effective, 16.5% of these procedures fail, often due to tortuous vasculature. In contrast, research suggests that transcarotid access reduces the time to 26 minutes, saving 60 million neurons. The number of thrombectomies performed annually has grown exponentially since 2010, but there is still unmet demand as only 10% of cases that could benefit from thrombectomies receive them. To solve this issue, we present carSEAL, our innovative device that leverages the geometry of two concentric cones. First, the inlay plate and cone are deployed on its side through an 8 French catheter. Once in the vessel, the surgeon pulls back on the device to guide the inlay cone through the opening and secure the plate against the vessel wall, blocking the majority of bleeding. The onlay cone is then connected outside the vessel along with collagen to stop residual bleeding. Current closure devices are unable to meet the challenges of the carotid's high-pressure environment. Only carSEAL has both a low-profile intravascular and sturdy extravascular component, creating a safe and effective seal. The target price for our device is $400. We feel that at a minimum, we can comfortably obtain $128 million of the market based on the 320,000 annual US thrombectomies. This is just the floor though, as a successful closure device can be expanded beyond thrombectomies to endovascular procedures in other disciplines such as cardiology. Globally, there are 7 million endovascular procedures annually, setting our potential target at $2.8 billion. Our team is comprised of 5 Georgia Tech engineers, as well as Dr. Robbie Talk and Dr. Ricardo Domingo from the Mayo Clinic Neurosurgery Department. Combining our clinical and engineering backgrounds will help us turn this idea into reality. Thank you for your time, and I will now take any questions.
Have you been able to test a prototype?
Yes, so we have recently just conducted some testing on 4x scale. With the equipment that we currently have at Georgia Tech, we've scaled up our device to 3D print it, and we've done some testing in a Penrose drain, which is scaled up size, but comparable in terms of its elasticity to the carotid artery. So what we found with our testing so far is that we're able to prevent leakage at mean arterial pressures that are beyond what the normal mean arterial pressure is for patients. So we feel comfortable moving forward as we scale down our device that it will create an effective seal for the carotid artery.
Kind of adding to that, is there a plan for a clinical trial or something at a bigger scale?
Yeah, so our next steps moving forward is we've actually just filed a provisional patent application as of yesterday, and we'll be moving forward with this idea to scale down and develop the other deployment housings that are needed for this device. So once those prototypes are complete and we have a high fidelity prototype of the entire process, we plan to do preclinical testing. We'll be presenting at a conference in March and then hopefully publishing some findings by the summer.
I feel like you answered all the relevant questions I had. So maybe I'll just ask one that's out there. Who would be, your target, like strategic partner or acquisition, company?
As far as acquisition partners, we definitely feel that there are competitors in this field who would be interested. Mainly Abbott or companies like Medtronic, Boston Scientific are also developing these devices. They may be interested. There's also a company called Silk Road Medical. They do a lot of procedures it's called TCAR for transcarotid revascularization. And that was something we found early on in the process. And we feel that our closure device could fit very well within their suite of products. So they could be a potential partner down the road as well.
Thank you.